So my patient Margot came in last week complaining of pain on her upper right and lower left sides of the face. We had a consult and talked about it, and we found out that she's going to have these teeth extracted. I found this out by looking at her radiographs. So, Margot, we're going to take a look at your medical history. Has anything changed since the last time we looked at it?
No.
No allergies to any medications?
No.
Blood pressure's okay?
Yes.
Okay, we're going to take a look at your vitals in a minute, but I just want to make sure. So since we reviewed her medical history and everything seems to be okay, we're going to move ahead and we're going to look at her vitals. So, the first thing we're going to look at is we're going to take her pulse. Mind just putting your arm out for me? Thank you. And it's about 60 beats per minute, which is perfect. And we're going to look at your blood pressure. This. And it's 120/80, and that's perfect. So we're ready to get going. For the purposes of this video, I will not be wearing my glasses or a mask, but in a real life situation, I would be wearing a gown, gloves, a mask, and eyewear. We're going to go over the proper armamentarium. So first, we have the Minnesota cheek retractor. We have a tongue depressor. We have Lidocaine, which is our topical anesthetic. We have cotton swabs, cotton rolls, a carpule of lidocaine, 2% HCl, 1 to 100,000 epinephrine. We have our syringe with a thumb ring, finger grip, piston rod, harpoon, and threaded tip. And then we have our two needles. We have a long 27 gauge and an extra short 30 gauge. And then we have the needle cap. Okay, Margot, before we get started, I just want to ask how you're doing. You feel all right? No anxiety? No nothing? Ready to go?
Ready to go.
Okay, so again, before we get started, I just want to say some side effects that could happen after we give you the local anesthetic. So we might see an increase in your blood pressure, some redness or swelling around the site, some anxiety, or a headache. So I just want to let you know that before we get started, just in case afterwards you get these symptoms. Does that sound okay?
Sounds great.
Okay. And another thing I want to say is that although her blood pressure and heart rate are good, if she did have high blood pressure, although the AHA has said using lidocaine with 1 to 100,000 epinephrine is okay, we could use mepivacaine or lidocaine without epinephrine. But since this is not the case, we're going to move ahead, and Margot, I'm just going to ask you for your informed consent. So this is just our contract saying that you accept the treatment of extracting the two teeth. Okay, so you accept?
I accept.
Alright, perfect. And now we're going to assemble the syringe. So what we're first going to do is we're going to pull back on the thumb ring. We're going to insert the carpule of lidocaine. We're going to push down on the thumb ring and engage the harpoon. We're going to take our needle with the cap on. We're going to screw it onto the syringe. And when we get ready for the injection, we're going to take off our needle cap. Before we get started with the injections, I'm just going to lay you back a little bit just to make you more comfortable. And can you just put your head back on the headrest, please? Thank you. Alright, now we're going to get started. So Margot, we're going to get started on your lower left tooth, the mandibular second premolar. Okay? So first, we're going to use a topical anesthetic. We're just going to rub this right at the site. We're going to let it sit for a minute or two, and that's just going to make you a little numb so it makes you more comfortable for the anesthetic. So now, we're going to inferior alveolar nerve block. So we're going to use our long 27 gauge needle. We're going to come. We're going to find the coronoid notch. We're going to go just medial to that, and we're going to inject the needle in the pterygomandibular depression, which is just between the coronoid notch and the pterygomandibular raphe. We're going to inject our needle until we hit bone. We're going to retract a millimeter or two. We're going to aspirate to make sure we have not hit a blood vessel. And then we're going to inject the anesthetic slowly and remove the needle. Now that we've given you the inferior alveolar nerve block, we're going to give you a long buccal nerve block. And so again, we're going to be using our long 27 gauge needle. We're going to come and we're going to have the needle parallel to the occlusal table. We're going to go distal and buccal to our last molar right into the mucosa. And we're going to inject. We're going to slowly inject our anesthetic, and then we're going to pull our needle out. So now that we've finished giving you the anesthesia for the lower left tooth, we're gonna move on to our upper right tooth, okay? That sound alright? So, we're gonna be giving her a maxillary, buccal, and palatal infiltration. So we're gonna take our lidocaine, which again is our topical anesthetic, and we're gonna rub it right on the site. We're gonna let that sit for a minute or two just to get a little numb. And then now we're gonna take our syringe, and for these infiltrations for the maxillary, we're gonna be using an extra short 30 gauge needle. For the buccal infiltration, we're gonna have our needle parallel to the long axis of the tooth. We're gonna go into the mucobuccal fold. We're gonna inject the needle. We're gonna aspirate to make sure we haven't hit a blood vessel. We're gonna inject the anesthetic slowly, and then remove the needle. And now the last anesthetic we're gonna give you is the maxillary palatal infiltration. So again, we're gonna be using the extra short 30 gauge needle. We're gonna come, you want to open your mouth for me, please. We're gonna go palatal to the tooth between the gingiva and the medial palatine suture, 90 degrees to the palatine bone, and parallel to the long axis of the tooth. We're gonna inject the needle. We're gonna aspirate to make sure we haven't hit a blood vessel. We're gonna inject the anesthetic, and then we're gonna retract the needle. Now that we're done giving our injections, we're gonna have to properly dispose of the syringe. So what we first need to use is the scoop technique. So we're gonna take our needle, and we're gonna scoop the cap so that we don't stick ourselves with the needle. Now that the cap is on the syringe, we need to properly take it apart. So what we're gonna do is we're gonna pull back on the thumb ring, we're gonna remove the carpule, and throw this in the sharps container. Next, what we're gonna do is we're gonna unscrew the needle, and we're also gonna place this in the sharps container. And then we're gonna take the syringe, and we're gonna put it in the red bag and properly dispose of it. Alright, Margot, so now we're done giving you your anesthetic. How do you feel?
Terrible.
You feel terrible? Alright, what's wrong?
I feel lightheaded, dizzy.
Lightheaded and dizzy? How about your eyes? Do you have any blurry vision?
Yeah, I can't see straight.
Okay, so since Margot is lightheaded and dizzy and she has blurry vision, what we would do is we would lean her back in the chair, we would call 89828, we would retake her vitals, and we could give her some oxygen. Thank you for watching the video.